Welcome to ET Studios Tech Heal in association with ET Health, where we explore the cutting-edge innovations and technology transforming healthcare in India. Today I have with me Varun Gera, who's the founder of HealthAssure, which is the convergence of health tech and fintech focused on primary care. Thank you so much for joining us, Varun.
My pleasure.
For our viewers and also for me, if you could explain what I just said, what HealthAssure is exactly.
Sure. So HealthAssure, we founded 13 years back. It's been a while. So we are focused on primary care. So across 1,200 cities, we have, we tie up with medical centers. And we also are the convergence of fintech. So one is, of course, that we have an HMO. In our industry parlance, HMO is Health Management Organization, where we aggregate, could be GPs, diagnostics, pathology, home care, etc. And we have now moved into fintech as well. So we converge the two in 1,200 cities.
When it comes to digital health, where is India currently?
So India is a very large country. And of course, the population is the highest in the world. So it's still at early stages because the kind of size of the need which is there. And the way healthcare evolves, it has to be and become an ecosystem, and to make an ecosystem takes time. So we are still at early days.
But there is work that started on it. We have the National Digital Health Mission. We also have a health ID that we're all looking forward to. Apparently, you told me you can get it right now if we need to.
Yes, you can. So, of course, I think government is very serious about providing healthcare to its citizens, especially if you're looking at the below poverty line. And they also want to extend it to people who are elder, so more than 70 years, you must have seen in the budget recently. So they're becoming bigger and bigger payers in the market. And for that to become efficient and even reasonably priced, you have to digitize the entire ecosystem. So yes, you can get your health ID, and government is doing a lot of tech enablement in this ecosystem.
Well, you are entrenched in digital health, in health enabled by tech. If you could tell us the benefits of digital health.
Yes, of course. I think so. If you're looking at our business, we are aggregators of primary care. And in aggregation, imagine 1,200 cities. So what we claim is that within 5 kilometers of any person in 1,200 cities, we provide them 65,000 permutation combination of primary care. So if a person wants a GP plus X-ray, could be 2D echo, mammography, whatever it is, could be in smaller cities. So imagine to be able to enable that. How do you know which center has all these facilities next to your house at a good quality, at the right price? How was it last week? How was it a year before? So technology is very, very important for that. So that at least goes for us. But if you're looking at the digital health, it applies everywhere. So if you're looking at, could be your, med tech, as you said, how is that tech enabled? If you're looking at hospitals, how are they tech enabled? How are the doctors, in terms of tech enabled to say, how do I take care of my patients who are in ICU? And how do you know that this particular patient needs help as of right now? So technology, has to pretty much go all across the entire healthcare ecosystem for it to work. So yeah, health tech is very, very important, but it's a very wide word.
Absolutely. It encompasses so many, right?
Yes.
Now at HealthAssure, what cutting edge technology do the services you offer provide?
So, as I said, the insurance in India is 30 plus years old. So you could buy an insurance policy earlier, you can buy it now. But can you imagine that the insurance does not cover day-to-day care? It only covers hospitalization.
Yes.
But if you're looking at the needs of individuals, it's about saying, hey, when I want to go to a doctor, can you help me on that? Can you pay for that? Or for that matter, can you tell me which is a better doctor to go to? And that doesn't get provided right now. So this is where we have plugged in. And to make that happen, of course, ours is a 13-year-old journey. And, the assets that we've created now allows for something like an OPD insurance, which is primary care insurance. So that is only possible through technology product, and we focus on that. So I think that for me is to how do you manage an ecosystem to take care of your needs and say, I can pretty much take care of all your primary care needs no matter where you stay in India.
Since you've been in the industry for 13 years, you told me one has to be very patient. What has been the biggest technological intervention you've seen in healthcare in India so far?
healthcare typically is very slow moving when it comes to technology interventions, unlike the other industries. Many reasons for that. One, of course, is that the delivery of healthcare that doesn't change tremendously. If you go to a doctor, it's going to be a similar doctor that you went to 20 years back. If you're looking at surgeries, that's changed a lot, but still, it's a very on the ground, kind of work. So the technology is more of enablement, and I think so. If you're looking at now, the scale element has become bigger, the specializations have become bigger, and that again requires technology. So I would say it's still early days right now in terms of how do you see technology having changed the ecosystem. But I would say one of the biggest plays when it comes to a change in healthcare is when insurance comes and starts making a bigger role, and that you've seen now, especially after COVID. And number two is when government comes in saying, I want to play a part in this one. So these are two big ones. I think the first wave you've already seen. So there are already 6 to 7 standalone health insurance companies in India, which is the kind of specialization which is required to aggregate healthcare. And now government coming in also in a bigger way are the big changes which will enable everything, including technology.
What are the challenges that you have faced when you have tried to integrate technology into healthcare services?
So as I said, so the job which we are in, which is aggregation of primary care. So imagine if you want like a GP consultation and 2D echo in Bhopal next to your house. Imagine what can go wrong.
Too many factors.
Too many factors. It could be that, hey, you don't have a center next to your house. And maybe the center which is there, it doesn't have 2D echo, it only has a doctor. Maybe that particular day, the doctor did not come in. Maybe the machine broke down. There could be so many things which can go wrong. So if you're looking at technology integrations, it is a journey. And of course, we are trying to make the ecosystem more efficient. It is a long journey. But I think these are the challenges which you face day in, day out, at least when you're looking at our kind of business.
During COVID, we had Arogya Setu.
Yeah.
Would you say that was the biggest digital health adoption by a country, especially like us?
Definitely. At that time, we had to, vaccinate every Indian, and that was massive. I think imagine the population we have. Imagine the need for an access to say, hey, I have the Arogya Setu, app, and I can show you, and I can therefore enter the airport, or I can enter a shop, etc., etc. So it was the largest consumerization of health care, which was enabled by the government. Wonderful effort.
Do you think there could have been an avenue for continuation of that, considering so many of us already had it?
Yes, I think it could have, but I think the healthcare ecosystem evolves in disparate ways. I think in case there was already a tailwind on that with resources and a plan, it could have happened. But I think the other initiatives that the government is taking, which is the digital health mission and the healthcare ID, I think those are all, in a way, filling in the same gap.
And so many of us have wearables now. What are the sort of insights we get from it, and are they actually helping us better our health?
Yes, I think the wearables are gaining more and more importance. One, of course, is for the individuals to say, hey, I need to take care of my health. For myself, I need to understand how does my body behave? How did my habit change in the last 1 month? Was I more fitter, or did I eat wrong? Things like that, they all are the effect of wearables. You can actually find out those answers. It could be like, how did I sleep? So given that now more and more we are looking at our health as a comprehensive pattern, individually, of course, it's great. Now more and more organizations are saying, I can kind of connect all of them and then give you that answer. So that is where, a lot of companies are doing that as well. And then you have insurance companies who are saying, if you take care of your health better, I'll reduce your premiums. So I think it is a journey.
Can you give us an example of where technology helped you provide better services at HealthAssure?
So that's all the time. For us to find out suppose we give service to the customer and the customer used, whatever service, could be a GP, could be, eye doctor, could be some kind of radiology exam. How was the customer's experience? And I think so based on the customer's experience, we get NPS scores.
Yeah.
And the NPS scores have to go back, filling into that. How do we know that, the access was there? Maybe the customer had to travel more than what we would have liked the customer to travel for that particular need. So how was the quality? How was the, waiting period? All these needs is where I think it's only through technology. Like we right now manage 4 lakh new customers a month. To be able to manage that manually is impossible. It has to happen through technology. So it's always helping us, and we are actually upping the game of saying how can technology automate more and more about us.
So tell us about that, in the future, how do you think you are going to be advancing healthcare, perhaps by using technology or, of course, other methods?
So, as I said, we are trying to up technology, how that can help us create products, create better products, do something better for customers. So the way I look at the healthcare needs of a person, human body is very complex, and you would have needs from, could be general cough and cold, could be something acute or something even chronic for that matter. And every time you have to go to someone new, could be a new dental need, you have to go to a dentist, you move from a Bombay to a Delhi, suddenly all your ecosystem is gone, right? It could be that, your kids are born and you want to get, your vaccinations, or as they get older, pits and sealants for their teeth, etc. So all of these needs is something which we are trying to work towards to say, how can we help you take control of your health at an affordable cost? So this is where technology, we are working through technology to say, how do we profile people and then therefore engage with them to get into so-called managed care, which is like if you're looking at the earlier concept, it was a family GP, right? That is pretty much gone right now, unfortunately. But so I think that needs to be taken up by so-called an organization right now. And that's where the managed care element comes in to say, I manage your care even if it is not in the same avatar as the earlier doctors.
Now, what do you think are the biggest trends in health tech currently?
Health tech is, I think the great part is that the India's entrepreneurial system has become so strong. And I'm seeing so many companies come into so many areas of health tech, whether it's, the medical devices, whether it's in primary care, whether it's in terms of hospital management systems, could be even analytics to say, hey, there's data which is coming in, how do you analyze data and make some sense of that? So, India's healthcare market, I think it's coming of age right now. It's probably the hottest area to be in right now. So yes, I think it's evolving in pretty much all directions.
Thank you so much for your insights, Varun. It's been a very knowledgeable conversation indeed. And best of luck for your endeavors with HealthAssure.
Thank you. Thank you, Shilpa.
Thank you for your valuable time, and thank you for watching. And for more such interesting conversations, remember to stay tuned to ET Studios Tech Heal in association with ET Health.